Hi, welcome to this month's staff chat. My name is Priscilla Andrews. I'm the clinical manager at the Cancer Wellness Center. If you've been to one of the staff chats or viewed one of our staff chats before, welcome back. If this is your first time here, the staff chat series has been created as a way to give insight into some common issues and concerns that people in the cancer community face, and to be able to be a part of a conversation between two professionals as we talk about some of those issues and concerns. And I am so pleased today to be joined by my newest colleague at the Cancer Wellness Center, Gina Baldacci. Welcome, Gina. Thank you for being here with me today.
Thanks for having me.
Yeah. So Gina, I know you started with the center just last month, but you bring with you a lot of experience with the cancer community. So I wonder if you could just share with our viewing audience some of that background that we are now benefiting from at the center.
Yeah, for sure. Let's see. So I did my focus in graduate school. I'm a licensed clinical social worker, and my focus in graduate school was on health social work. So I knew I wanted to be in healthcare, and my second year field placement was actually at Children's Memorial Hospital, which, as many people know, is now Lurie Children's. So when that internship was over, I actually interviewed for a position in the neuro-oncology program, which is part of the larger oncology program. So I was sort of stumbled into the cancer world that way, really out of luck, because there was a position open in oncology. So I worked at Children's for probably close to, I want to say 13 years I was
Oh,
there. So I did the move when the hospital moved downtown. And then we're sort of at that point where I felt like I had done all that I could do within pediatrics and really didn't want to move anywhere else within the hospital. Truth be told, I really had a good experience within the brain tumor community, and the medical team really enjoyed working with them. And so I felt like I needed adult cancer experience.
mm,
So I just moved next door to Northwestern and took a position in radiation oncology. So I was in radiation oncology for 2 years. And then during that time, I spent also within a clinical trials clinic. So
mm.
I was mostly outpatient and worked really closely with the cancer center. So that was a good experience as well. And then I moved out of the country. So then I was out of the country doing healthcare social work in the Middle East for almost 3 years. And then last summer moved back to the States and started a private practice. And then, of course, came and worked, took a position at the Wellness Center. So kind of is full circle. And it's been great to be sort of out of the healthcare experience, but still using all of that good knowledge now that I'm on the other side, is kind of how I like to look at it. Yeah.
Well, and I'm curious, you started out wanting to do health psych related stuff,
Yeah.
stumbled into oncology.
Mhm.
For you, what do you think kept you in the world of the cancer community?
So I think I was just really lucky in that it always felt like a really resourced community in terms of um, the community really supported patients and families. And so I really have worked with babies all the way up to seniors. And so I saw, as people navigated this illness, whether they were toddlers or school age children, parents, grandparents, brothers and sisters, um, young adults, middle aged people, elders. It didn't matter really what age they were, whether I was working with doctors or nurses or physical therapists or
Mm,
other social workers, psychologists. Um, when you work in the medical field, I was always really lucky to have all of these wonderful community supports to sort of support patients and families. Because the reality is, not only with cancer, but really any illness, you're still living your life and sort of moving through an illness. So I think it was just sort of a nice way to be like I was really lucky to be a social worker within this community, and the community truly does support the sort of the experience of having cancer. So it was always just a very I always felt like it was just such a resourced community to
Mm,
be a part of, and patients are kind to one another, and
mm,
medical teams are kind to one another. So it was just a really I don't know, it was just sort of it was a good experience as a social worker. And you're constantly learning. So I think even like professionally,
sure.
there was always something new to learn or a new person to meet. And even now that I'm all these years out of it, or not out of it, but like away from, I still, even coming back to the States now, I still know my colleagues. I still have colleagues at Children's that I talk
Sure.
to, at Northwestern that I talk to, and that I refer to, and that I talk, that I say like, hey, I need a resource. Or now that I'm in a private practice, they'll refer to me. Now that I'm at Wellness Center, I can call them and say like, hey, can I send people to you, or do you have people that we can use, that we can advertise programs at the Wellness Center downtown. So
Yeah.
it's like this constantly, it's this growing community, but it's just this kind community that just I don't know, advocates for one another.
Sure.
And so it's been like a nice group to be a part of.
Yeah.
Yeah.
Well,
Yeah.
and I think because of that, um, both just the like resume part of your experience of being
Yeah.
in the healthcare community, and also, having such a background in that collaboration amongst all the different parts of the healthcare team, that's why I've invited you here today and wanting
Yeah.
to get your insights on how to navigate that healthcare system. Because I think probably I don't need to tell you that for many people, the cancer diagnosis may be the first time that
Hmm.
they've really had to, in a in-depth, substantial way, interact with doctors, nurses, hospitals, other than their annual checkup or something like that, which can be
Right.
very overwhelming if you don't have a frame of reference. And I think also if you don't know how to communicate effectively, if you're not aware of what resources are out there. Um, so, I mean, I think to just start the conversation, I'd be curious to hear what your thoughts are. A big thing that comes up is communication when I'm working with somebody who's newly diagnosed, is communication with their healthcare team, kind of trying to figure out what to ask their oncologist, maybe how to figure out, like, is this oncologist a good fit for me if I have the luxury of taking some time to figure out who my oncologist is going to be. I'm curious what guidance or insight you can provide around
Yeah.
those sort of early days of getting your cancer diagnosis and starting that treatment planning.
Yeah. So I think those are great questions. So I think of course, pediatrics and adult care is a little bit different, but some of the themes are exactly the same. And I think it's important to sort of tease out that um, some people have a ton of medical experience and medical knowledge, and some people, like you said, go to the doctor's office once a year and have been
Yeah.
healthy and never had an issue ever in their life before. Um, so always good to sort of keep in mind. The other piece that's important is some people come in and they'll get a diagnosis and things have to happen very, very quickly. Whereas other people will come in and get a diagnosis and have a little bit more time to make decisions. But all that being said, you always have the opportunity, hopefully you have the opportunity to ask questions, to gather information. And I always try to keep in mind that if you're a child, your parent or your caregiver is your best advocate. And if you are an adult, hopefully you are your best
Mm,
advocate. You always have the right to ask questions and gather information, and you should always ask questions and gather information. I would tell people, I've been telling people for my entire career, no question is a bad question. If
mm,
you don't understand something, you say time out and you need to ask for clarification. People explain, you could be in a room with three doctors. or 3 people all explaining the same information, and they're explaining it differently. So you having some amount of information is really, really important. The other piece is when we're in crisis, there's only a certain amount of information we can take in and truly process, right?
Yeah.
In that
Yeah.
time. So of course, if you can bring someone to those initial visits, if you can have another set of ears and another set of eyes, that's really, really important. COVID is a strange time because of what hospitals some of the safety protocols they're putting into place, but that's really, really, really important. Um, and the other thing, I just try to really instill in people that you can ask, you can ask for other opinions. You can ask, um, you can ask for the second opinion. You can write questions down before you walk into an office. You can ask a doctor, do you treat other patients with my condition? Can I talk to somebody that's also gone through this? The
Mm.
fortunate part about living in our state and in the United States is that most people that are being treated for illnesses like cancer are being treated at large cancer centers. So most cancer centers are, multidisciplinary teams. So you've got a lot of providers, and you don't just have a doctor, and we can talk more about like who's on your team, but you've got multidisciplinary teams. So you've got lots of providers, which lends itself to also being sort of an overwhelming experience. But you can, I would say to people, and I would meet a lot of people at diagnosis, not so much in my adult role, because being in radiation, I'm not the first
A
person
little
you
bit
meet.
further along, right?
But at children's, I often was the first person at families. I would go with the team. Sometimes I would meet families with the team in the surgery waiting room
Mm.
before their child was going into surgery. Sometimes I would meet a family while their child was in surgery. So as you might imagine, I would go with a nurse, and she would call and say, we have a new family, and I would sit with them. And in that moment, their decisions, of course, they were sort of in crisis. And so sometimes I would just listen to the kinds of themes that were coming up, and we would just try to give them information as best we could. So it really kind of depends, but a lot of times your treatment teams are of course used to working with people and families and people in crisis. So ask questions. Never be afraid of asking the same question more than once, because
Yeah.
you're going to ask it more than once. Sometimes you're going to forget about it. You're going to forget that you've asked it. We as treatment teams are used to people asking questions more than once.
I'm so glad you brought up that point, because I think it ties to what you said earlier, which is like research has shown like neurobiologically, when we're in crisis, we literally don't process and store that information the same
No.
way. So it may require repeatedly asking the same questions so that you can retain that information.
Yeah.
And I think the other thing I want to highlight too is, I know I can get into jargon
Yeah.
sometimes, right? And
Yeah.
I'm not a medical doctor trying to explain cancer, and I don't even realize that the way I'm explaining something isn't
Mhm.
accessible. And
Yeah.
so I think that 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 guidance of letting the healthcare team know, I didn't quite understand what you just said there.
Mhm.
Could you repeat that, or could you simplify that?
Yeah.
Because as you said, I think that importance for people to have the information that they need at any
Yeah.
given time.
And you can say, I don't understand, or I'm
Yeah.
confused,
Yeah.
or, and I think as a social worker, when I started, obviously I knew a little bit more when I went to radiation, because I'd spent 13 years look in tumor board and going to clinics and listening to new diagnosis talks. But when I started at Children's, I didn't know. I mean, I had never looked at an MRI before. I didn't know about chemotherapy and blood counts, and I didn't
Sure.
I didn't know anything. But I learned the medical piece. But there's a practical part of treatment, And so families and patients need to say, if you don't understand, you need to say, I don't know,
Yeah.
because I would say, I don't know. And when you say this and this and this, what does that really mean for my life? How many days am I going to be in the
Lovely.
hospital? And many days am I going to be, um, am I going to miss work? Is my child going to miss school? Am I going to need to recover? Can I drive? Like those practical
Yeah.
questions. And so you can say, I don't understand. I'm confused by what you're saying. And again, and doctors need, or nurses or whoever is explaining the information to you, and sometimes the way, you know do you understand things verbally? Do you need a picture? Lots of doctors
Yeah.
draw stuff out, like,
Different
um,
learning styles.
different learning styles. So it's okay. Do you need it in another language? Do you need
Mm.
it? So I think having the pediatric background and having, I've had to explain things to 4-year-olds and 8-year-olds, but when you think about the medical jargon that we use, I've used
A
play
little bit
before
above
and
that.
pictures, but sometimes you do
Yeah.
like, I'll think back to some of my, some of those. That's how I learned
Yeah.
some of what I know, and I'll take that as you know, you have to use different learning styles. But I knew very little when I first started, so I always try to advocate, even as I've moved on in my career, that it's really good to ask questions. And if you don't understand, because knowledge really is power, and it will help you navigate the more you know, and you'll feel
Well,
better.
and it makes you a better decision maker, right? I mean,
Yes,
research
for
shows that
sure.
if you have accurate
Yes,
information,
yes,
it reduces anxiety, it makes you a
yes.
better decision maker. And, I think one of the things you said really stood out to me is, asking the doctor or the nurse, the healthcare team, the things that are important to you,
Yeah.
because what may be important to you, they just might not think of, like,
Right,
saying that, right? Like, am I going to be able to drive? They might not have thought of, like, being like, oh wait, yeah, no, like, you're probably not going to be able to drive, like, because they
right,
just take that for granted. So, or you will be able to drive, right? The reverse could
right.
also be true as well.
Yeah,
um Earlier you mentioned something about the idea of second opinions, right? And
yeah,
sometimes that can come up front when there's a little bit more time, or as you mentioned, sometimes it's just an acute crisis and you're thrown into treatment, you're thrown into surgery, whatever it is.
yeah,
Sometimes second opinions come later.
yeah,
Something that I hear a lot is some flavor of, I don't want to make my doctor mad. And they may not say that language, but I think that people, they're really dependent on their oncologist, right? Like, this person
yeah,
may have been somebody that they feel saved their life, and yet they want to hear somebody else's voice.
yeah.
Um, so I'm curious, especially given that you were so close to the healthcare team, you know, what is the attitude towards second opinions that you've encountered? How do you find that goes over? What kind of collaboration happens um,
Yeah.
on that end of things?
I think it's quite normal for people to seek second opinions. I think that just as it's quite normal for people to seek second opinions outside of your healthcare site, I think it's also quite common, or it's probably very likely, that your healthcare site is also being asked to give their second opinion.
Hmm.
I think it's quite common in the medical field that that patients are asking for second opinions, and that their site that they're being treated, other people are also reaching out to ask, if that makes sense.
Yeah.
Um, so I think that if you need to seek a second opinion, you seek a second opinion. I don't think that, at the end of the day, I think that people have to feel good about the care that they get, and that they have to feel like that they're doing what they need to do. And I think that, at least my experience, and I can only speak from what I've done, I think most most medical providers probably would anticipate that people are doing their research, that people are asking questions, that people are talking to other patients. And so I don't think it's unreasonable to say to a doctor, um, what are other hospitals doing, or are there other treatments out there? I think a lot of times, people will say, well, these are the standard treatments that are being offered for your medical condition.
Yeah.
Um, Especially, and in this day and age, and I don't pretend to speak about treatments, but there are a lot of the different hospitals are sites for clinical trials. So there is a lot of information about clinical trials. I think most, at least the physicians I worked with, sometimes patients would bring information in and say, I read about this, I saw this. Is this something, should I look into this? Or what do you think? Um, Families, patients can always take their health information and send it to another institution or contact another institution. I think that I would always encourage if families would come to me or patients would come to me, I would say, talk to your provider about it. A lot of times the doctors know each other. I mean, they're going to similar conferences,
Yeah.
they're all publishing in the same journals. It's always a good idea to ask your team and to be transparent in that. Hopefully, if you don't feel comfortable talking to your physician, if you really feel like, gosh, I'm worried that they're going to have a reaction one way or the other, is there somebody else on your treatment team that you can talk to? Is there a nurse
Mhm.
practitioner, an advanced practice nurse? Is there a clinic nurse? Is there someone else that you can trust, that you can say, I'm having some questions and I really want to bring it to their attention. Um, it's quite a common question. So usually I feel like providers have gotten that question from other patients, and it's not it's a conversation that they have, in my experience, quite often.
It's not the
So
first time. You're not going to be
yeah,
the first person
yeah,
to ask this question.
yeah,
And I
yeah,
think that aspect that you brought up of, um, not to make broad generalizations, but I would
yeah.
say some hospitals in Chicagoland have a very strong reputation of being very heavily research institutions.
Hmm.
And so, you know, sometimes you're not going to that oncologist because of their bedside manner. You're going to that oncologist because of their involvement in the research and that. And I think that idea of, going to the nurse practitioner, talking to the nurse, of finding that person that may be more approachable as a first line, or maybe somebody who it feels more comfortable bringing up your questions or concerns to, that may then help bridge you to talking to the oncologist in a more effective way. I certainly know
Yeah,
I've had patients who, were were transferred to a new oncologist, different personality than they were used to, wasn't quite sure how to navigate that relationship, felt more comfortable talking to the nurse. Nurse was like, I'll just bring this up with the doctor. And then that completely opened up the relationship between my
yeah.
client and their oncologist. And now they have this very trusting
Hmm.
relationship, feel really good about being able to talk openly with that oncologist about their concerns. So sometimes it may take finding um, that advocate, or that, what's the
Yeah,
word I want to say, that that person that you feel more safe with, to get to the point of getting what you need out of that healthcare
yeah,
team.
yeah,
um, Something, I think you mentioned this earlier, and I just want to take a pause because I don't know how aware people are, because you mentioned the idea that even within your oncologist, I think you sort of implied sometimes behind the scenes, you're already getting a second opinion. And you may have mentioned earlier that idea of the tumor board.
oh
And I'm just
yeah,
curious if you could just, because I don't know, this is one of those things where, like, I know what the tumor board is and you know what the tumor
yeah,
board is, but if
yeah.
you're not in the oncology world, you may not recognize or realize what is involved with the tumor board. So could you just speak to what that is a little bit more?
Yeah, a lot of hospitals, I imagine, I imagine this are pretty standard across hospitals, where medical teams get together and discuss patients, where they look at um, where they look at medical information of new and current patients, and you've got all the providers in the same room, and so that is medical staff as well as, maybe psychosocial team. You have a social worker, you might have a psychologist in the room, you might have your physical, occupational, speech therapy. So different people involved in the care of a patient. And you see this in medical centers all over the world, and you see it not just in oncology, but you see it in heart transplant. You see it in all sorts of, because
Yeah.
you're bringing all of the heads together to look at a patient and the medical condition, and you're sort of discussing each person's role and the treatment and the intervention. And you might be looking at scans, MRIs, CT scans, pathology, that kind of thing, and deciding on a treatment plan or a proposed treatment plan, and you're getting different opinions. That would also be a point where if you had, if there was a second opinion, we might discuss it at
Mm.
tumor board. So, you've got a patient from Alaska who sent in their information. Well, let's look at it at tumor board. And
Mm.
so sometimes the information is presented, and the team looking at it would say, well, this is what the Alaskan team is doing. We would
Mm.
actually do the exact same thing. So the second opinion is, we agree with exactly what the
Yeah.
doctors are already doing. Or the second opinion is, we would agree, but they could also try this. This isn't wrong, but maybe we would try this. Or
Yeah.
actually, there might be this other thing that they want to try altogether. So it's just really gathering more information. And sometimes, like we know from this experience, sometimes we don't know what to do, or sometimes, there's um, sometimes decisions are really hard. There's hard decisions to make. And so
Sure.
families or patients are trying to make the best decision with their treatment team. Um, but I think being in a hospital, there's so much that goes on behind the scenes that, of course, patients don't know about. That as a patient myself, like, I'm always fascinated when I walk into the hospital and it's a flurry. People are running all over the place. And it's because they're trying to get to the next place, and there's so much going on. But there's lots of meetings and lots of behind the scenes and lots of planning and lots of and the tumor board is like radiology is at the tumor board. The radiologist, you never see the radiologist. Most people have never met a radiologist. The radiologist comes to, the pathologist is there. I'd never met a pathologist
Yeah.
before I went to a tumor board. So you've got a lot of these other people, and patients don't go to tumor board. It's not something that would really be appropriate for them to
Be a
go
part of.
to. Yeah.
And I
But
think,
it's a lot of sharing of
and highlighting
information.
that fact that the encounter with your oncologist and the nurse practitioner or the nurse may just be the tip of the iceberg. You're having that interface, but underneath the surface, behind the scenes, there's all of this other input and support that you may not even be aware of, that is culminating in the recommendation that the oncologist is making.
Yeah,
And I,
and I don't. Oh, I'm sorry. I don't know. Like it's funny because when I was, and this may have changed because I've not been there. I've not been employed there in a while. But we used to do, when I was at Children's, tumor board would be on Thursdays. And so a lot of the families would know because the team would say, we're going to discuss it at tumor board. And so I would be in clinic one day and just talking with a family, and a parent would say, oh, we're going to be changing treatment. Our treatment's going to change. And I would say, oh, okay. Well, and they would say something to me like, well, you're going to review the MRIs, because they knew I would go to tumor board. They'd say, you're going to review his MRIs on Thursday at tumor board. So families would know. But
yeah,
again, and then they would say, well, who's going to be at tumor board? And I would say, well, all these people. So I think, and I don't know how much of that is spoken about in sort of the adult world, but I think it did offer a bit of reassurance, because as a patient, then like, oh wow, they really are meeting. So I would sort of say to families, and maybe they know it's talked about in the adult world. I would say a little bit in when I was in radiation. So your teams are really talking and planning quite a bit behind the scenes.
Well, so that's sort of the behind the scenes. If we move it to like in front of the curtain, if you will,
Yeah,
on the
yeah.
stage, you know, who are the typically the key players in a person's healthcare team?
So I would, of course, say your oncologist. And for some people, they see surgical oncology or they see a surgeon. Some people see radiation oncology. Some people see a specialist from another, um, depending on where their cancer might be. Are they seeing a urologist or are they see, some other part of the body? Um, so I feel like though you've got some other medical people. And then you've got usually a nurse practitioner and an advanced practice nurse. A lot of times you have a nurse, a clinic nurse in your outpatient setting. Um,
Wait, can I slow
and
you down?
yes,
How would you describe the difference between an advanced practice nurse and a nurse practitioner? Is there a functional difference or just different type of
no,
training?
no, I think so. It's interesting that you asked me that question. So I think they're quite similar. When I started, I feel like people were called, and I'm probably going to get some feedback on this, so I should have probably researched this a little bit better. Um,
I
I
put you on
think
the
it's
spot a little.
I think it's just a terminology because I feel like when I started, I would call people nurse practitioners, and then I feel like the terminology's changed to advanced practice nurses. So I don't know that there's much of a difference, but I should probably, before, I don't quote me on that. I would have to, I feel like they're, I can't be 100%
I
percent
mean, it sounds
specific.
like though, if like maybe the training might be different, the sort of again the behind the scenes thing, but I get the implication that like they may play a similar role from the patient
Yeah,
perspective.
yeah, you usually there is my understanding is that person can write prescriptions. So so in terms of you've got usually, so when I was in a pediatric setting in the oncology clinic, you had an oncologist, you had a advanced practice nurse, you had a clinic nurse, you had a social worker. Those were sort of your key players. And then of course that was in sort of your outpatient setting. That was your sort of your primary team. When you went in the hospital, your group was different depending on sort of who the inpatient team was at the time. When you were in the neurosurgery area, you always had your primary surgeon. So your primary team sort of stays the same, and then depending on which phase of treatment, things kind of moved. But you always sort of had your point person when you were in the hospital or when you were throughout your treatment. There was always the same person you were calling, your go-to person. Sort of, they would say, like, families would say, or the team would sort of say, who do I call if? So those are good questions
Mm.
that the team, the oftentimes the nurse practitioner or the advanced practice nurse would say, if you have a fever, this is who you call. If you have a
Mm.
question about appointments, this is who you call. If you have issues with lab results, this is who you call. Because I think for families, you have a list, or for even adult, patients in general, you have a list of 16 people. Well, that's great to know that you have 16 people on your treatment team, but who do I call? Like, which is the person? Um, so it's, on the one hand, it's wonderful that you have all these people involved in your care, but it's a little bit overwhelming. So it's almost like, who is my quarterback? Who is my go-to person? And then, like, what constitutes an emergency? When do I
Mm.
need to call? When do I need to call the on-call person? So having a better understanding of who your people are helps to sort of navigate that piece. And there's a lot of education around that. It's not just that you come in and you're given a sheet of paper. It's really, there's a ton of education around um, understanding, you know, your diagnosis, understanding basic oncology terminology, understanding if you've got a port, if you've got, I mean, so there's a lot of different education, and then sort of who your people are and who you need to reach out to.
Well,
And
and
it's done over a little bit of time.
I mean, it does sound like, you know, there is this team approach
Yes.
And that it is helpful if it's not clear to you as a
Yes.
patient or as a family member who to go to for what, that may be valuable to clarify up front. Who's my point person in an emergency?
Yes.
If I have a
Yes.
problem with scheduling, who do I
Yes.
call? If I have an issue with my lab values, what, I mean, I think the thing too that I often counsel is, what is the best way to reach you if I have a question?
Yes.
Is it phone, or do you want me to use the patient portal, right? Because
Yeah.
some oncology offices are very responsive if you put something in email or in the portal, and then others are like, leave a message with the nurse and we'll get back to you, right?
Yeah.
But if you don't ask that, you don't know kind of what the protocol is for your particular healthcare team.
And some places, I know some facilities will actually give patients like a little cardboard, like a card stock, um, like a 5x7 card stock that literally you can throw in your purse, or you can put it something, throw it in your car. You can, it's very small, but has all of your main contacts. And with the on-call pager number to call in case of an emergency. So you've got your on-call oncologist is
Gotcha.
usually, or medical oncology to call in. And then in the beginning, and they'll often say in the beginning, you call whenever. And I think, again, it's sort of that, and this is sort of the learning curve when you're first diagnosed. It's sort of the fear about getting inundated with all of this information, not being sure what to do, and also having this diagnosis that you're trying to manage and wrap your head around. And so that's the part about sort of trying to slow down, take a step back, ask your questions, clarify, ask the question again. You mentioned about the patient portal, using that patient portal, most likely not for an emergency, but for communication. If it's simple communication or regular or non-emergent communication is probably a better way to
Yeah.
say it. Use the patient portal because you're documenting, and then any provider that goes into your chart actually has access to that and can see.
Gotcha.
So then it's helpful, because when you think about that team of people being so big, if I as a social worker am calling a parent or calling an adult client, patient in radiation, but don't know if that same patient spoke with my colleague who's a social worker in the breast cancer center, or spoke with the dietitian in the breast cancer center, or spoke with their nurse practitioner in the breast cancer center, because I'm in radiation, which is in the basement, and they're over at Prentice. Like, I can tell if my patient has spoken with any three of them within the last week. I can tell if if they've
If it's in
used
the
the patient.
portal.
Yeah.
Well,
And
it strikes me that another benefit of that is, then it's in your words. Then it's
then
in the
it's in your
patient's
words.
words, right?
Yeah.
Because I can completely see that, and not out of any sort of malfeasance, but
Yeah.
if I read something or we read something as mental health professionals, we're going to pick out something, maybe even to document differently than if I'm in radiation or I'm in medical oncology or if I'm in
Yes.
surgery. And
Yeah.
so, if it's there and the other parts of your team can access that, they may look at it with completely fresh eyes, versus if you're leaving the message and it's getting translated into a note, for instance.
Yeah.
There's a little bit of game of telephone, if
Yeah.
you will, there. I'm just looking at the time and I see we're running. I can't believe it. I always am amazed at how quickly 45 minutes goes.
Yeah. Goes
But
fast.
I do want to turn our attention, we're talking about the healthcare team.
About this.
And then, I think there is the medical team that is like treatment diagnosis, but then there's all these other resource parts of the team.
Yeah. Tons.
And I think sometimes people are aware of them or not. Sometimes the healthcare team
Yeah.
will bring that up or not. Like I think something that I sometimes encounter is there's so many patients that a cancer center is treating that they may or may not interact with the social worker, especially if they're not in distress and they have a support
Yeah.
system. Um, and my guess is that you're very tapped into resources available within the healthcare systems that the nurses, the doctors, again, not out of malfeasance, but just that's just not their focus.
Yeah.
So I'm curious, like what kind of resources you see that are out there that are either tend to be really valuable or maybe are out there and maybe sometimes they're underutilized because patients aren't aware of them.
Yeah, I mean, I think again, we're sort of lucky in the cancer community that we do have a lot of resources in the hospital and in the community, which is great. So in pediatrics and in the adult world, my experience in pediatrics is I met a lot of patients at diagnosis, and in the adult world, because I was later in the treatment, I met people later. I think both places are doing a better job of trying to identify um, people in distress, but like there's also people like you mentioned that aren't in distress necessarily. Um, I always encourage people, if you haven't met with a social worker, to ask to meet with a social worker or a navigator. In the adult world, sometimes there are cancer centers within bigger hospitals. Um, there are navigators within bigger hospitals, and you can say, am I eligible for supports, financial supports, educational supports, transportation supports? Is there an art therapist, a music therapist? Is there supports to help my younger children or my school age children? Um, Pediatrics, because it's kids, I think, and we tended to meet kids and families at diagnosis and sort of follow them through treatment. Um, Looked a little bit different than my experiences in adult cancer, but needs are different sometimes too. And sometimes this happened in both environments. Sometimes, 6 months in, somebody would say, oh, I wish I would have known about 6 months ago. Well, I always think sometimes you really are a little bit overwhelmed with the medical information, so you can't always know about the resource stuff. But I just tell people, ask up front, ask and say, am I eligible, or can I talk to a social worker, or can I talk to someone about resources, emotional support resources, practical resources? Is there a financial counselor that I can talk with? Is there someone I can talk to about my insurance? And even if you talk to those people and they have nothing to offer you, that's okay. At least you know. And you can go back to them in 3 months and say, I spoke with you 3 months ago and I really didn't hear anything that was helpful, but I'm back again and I just want to review again. Might there be anything helpful now? And is there a support group I can learn about? Or because part of the resources that we as social workers offer are resources like wellness center. So sometimes it's community stuff. A lot of times
Mhm.
it's community stuff. So I again, it's another part about navigating this whole system. Is I've heard about the medical stuff. What about the other stuff? I
Yeah.
will say that a lot of the medical team is versed in who these other, the doctor will say, have you met the social worker? Um, it happens a lot in pediatric care, I think, because we've got kids and parents and grandparents, you've got sort of the whole family system. Adult healthcare looks a little bit different because you don't have the whole family coming to medical appointments. You just don't. And so, but the adult healthcare system, at least when I was at Northwestern, was doing, and I'm assuming this is continued, we were doing distress screenings prior to somebody's appointment so they could flag if they wanted to see a social worker. And radiation, we did our own screen so
Yeah.
people could indicate social work if they wanted. So there were different points throughout treatment. So again, if you feel like this piece is missed, just ask. You can ask anybody, you know.
Well, I want to like highlight as a final note because I want to be mindful of time here, but I mean, I think that importance of asking questions. And I think the other thing too is the social worker doesn't need to be somebody you talk to just because you're in emotional
No.
distress. And I think
No.
sometimes that's what people, there's a preconceived notion that that's what the social worker is going to be about. Or if I ask for a social worker, that's the reason I should ask for them. When
Yeah.
really it may be there are stressors related to the cancer diagnosis, or maybe unrelated, but now the cancer is making those other stressors, practical stressors, that there are resources there that,
Yeah.
you know, the social work team's already done the legwork to kind of know what's
Yeah.
there versus patients having to do their own research. So,
Yeah. And your needs may change over time. They may change
yeah,
throughout treatment, and that's okay. And you can always circle back and say, I have a new question, I have a new need. And a lot of times, you can ask. The great part about being in a hospital is you can ask someone who really doesn't know the answer to your question, and they're going to just turn around and go find somebody who does. I used to say I don't know to things all the time, and I would say, but let me find the answer for you. And that's one of the great things about a lot of these our hospitals, is that we do have people we can go to. So
that's great.
you are your best advocate, so keep asking questions.
Well, Gina, my time for asking you questions today at least has come to an
To
end,
an
but
end.
I want to thank you
Oh,
so much for being here
yeah,
and being a
thank
part of the
you.
conversation. And I want to thank those of you on Zoom or on Facebook Live, and those of you who are viewing this on YouTube for joining us for this conversation. We will be back. I will be back next month on March 17th for another staff chat, and hope that you will join us again in the future. So thanks for being here, and thanks again, Gina.
Bye.